What I'm about to reveal is going to completely shatter everything you thought you knew about high blood pressure. And when I show you the hidden cause that's affecting millions of seemingly healthy people right now, you're going to understand why your neighbor who runs marathons still takes 3 blood pressure medications, or why your friend who eats nothing but salads and does yoga every morning was just diagnosed with stage 2 hypertension. I'm Dr. Sandra Whitmore, and I need to tell you something that's going to change how you think about cardiovascular health forever. Being healthy doesn't guarantee normal blood pressure, and that statement terrifies most people because it challenges everything we've been taught about prevention and wellness. Here's what makes this so disturbing. Right now, there are thousands of people, eating perfectly clean diets, exercising 5 days a week, maintaining ideal body weight, not smoking, barely drinking, doing everything right according to every health guideline that exists, and their blood pressure is still 160/95, still dangerously high, still putting them at risk for stroke and heart attack despite their seemingly perfect lifestyle. I've been a cardiologist for 23 years, and I've watched countless patients sit across from me, confused and frustrated, asking the same question: why me? I do everything right. How can I still have this problem? And here's what almost nobody understands. There are 7 hidden causes of high blood pressure that have absolutely nothing to do with diet or exercise or lifestyle choices. 7 biological, genetic, and medical factors that can elevate your pressure no matter how healthy you appear on the outside. But I'm getting ahead of myself. Before I can show you these 7 causes, you need to understand something fundamental about blood pressure itself. Something your doctor probably never explained because it requires more than the 8 minutes they have for your appointment. Stay with me because what happens in the next few minutes is going to transform your understanding of why healthy people can still be at serious cardiovascular risk. Let me tell you about Jennifer first, because her story is going to reveal hidden cause number 7, and it's going to surprise you how something so common, so seemingly unrelated, can drive blood pressure through the roof. Jennifer was 54, a yoga instructor, vegetarian for 20 years, ran 25 miles a week, meditated daily. Her lifestyle was a textbook example of cardiovascular health. Her BMI was 22. Her cholesterol was perfect. Her blood sugar was normal. Every marker of metabolic health looked ideal, except one: her blood pressure, 158/96, consistently, year after year, no matter what she did. She tried reducing sodium even further. No change. She tried different exercise routines. No change. She eliminated caffeine completely. Still elevated. She was frustrated. Her doctors were puzzled. They kept prescribing medications, increasing doses, adding new drugs. Nothing brought her pressure down to normal range. Then one day, Jennifer mentioned something during a routine physical that changed everything. She'd been having trouble sleeping, waking up frequently, feeling exhausted despite 8 hours in bed. Her husband said she snored loudly, something that had worsened over the past few years. Hidden cause number 7 is obstructive sleep apnea. And here's why this is so insidious in healthy people. Sleep apnea isn't just a condition that affects overweight individuals, which is what most people assume. It can affect anyone, regardless of body weight, fitness level, or overall health status. Jennifer had a narrow airway, a structural issue that had nothing to do with her weight or lifestyle. Every night, her breathing stopped dozens, sometimes hundreds of times. Each time it stopped, her oxygen level dropped. Her brain panicked. Her sympathetic nervous system activated. Stress hormones flooded her bloodstream. Her heart rate spiked. Her blood vessels constricted. Her blood pressure surged. This happened over and over, all night long, every single night for years. And here's the critical part. This wasn't just elevating her pressure during sleep, it was reprogramming her cardiovascular system. Her blood vessels were staying constricted during the day. Her stress hormones were chronically elevated. Her body had adapted to a state of perpetual emergency response. Even though she was awake, calm, and healthy, her cardiovascular system was operating as if she were under constant threat. We sent Jennifer for a sleep study. The results were shocking. She had severe obstructive sleep apnea, over 40 breathing interruptions per hour. She started using a CPAP machine to keep her airway open during sleep. Within 6 weeks, her blood pressure dropped to 128/82, Not from medication, not from dietary changes, from treating the hidden condition that was driving the elevation all along. But here's what Jennifer's story reveals about the bigger problem we're facing. And this connects to all 7 hidden causes I'm going to show you. High blood pressure isn't always about what you're eating or how much you're exercising. Sometimes it's about underlying biological processes that have nothing to do with lifestyle. And if you don't identify and address those processes, you can eat kale salads and run ultramarathons for the rest of your life, and your pressure will never normalize. Let me show you hidden cause number 6, because this one is going to make you question whether your medication cabinet might be sabotaging your cardiovascular health. Hidden cause number 6 is medication-induced hypertension. And I'm not just talking about obvious culprits. I'm talking about medications and supplements that millions of healthy people take every single day without realizing they're raising blood pressure. Let me tell you about David, 62, recently retired, extremely active, hiked every weekend, ate a Mediterranean diet. Blood pressure had always been perfect, around 122/76 his entire adult life. Then suddenly, over the course of just 3 months, his readings started climbing. 138/88, then 145/90, then 152/94. He couldn't figure out what had changed. His lifestyle was exactly the same. His weight hadn't changed. His stress level was actually lower since retirement. What was happening? I went through his medication list carefully. He wasn't on anything for chronic conditions. No prescriptions at all. But then I asked about over-the-counter medications and supplements. And there it was. 3 months earlier, David had developed some knee pain from hiking. Nothing serious, just normal wear and tear. So he started taking ibuprofen, just 400 milligrams twice a day, a completely normal dose, something millions of people take without a second thought. Here's what David didn't know. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and others, cause the kidneys to retain sodium and water. They interfere with the prostaglandins that regulate blood vessel dilation. They disrupt the delicate balance that keeps blood pressure in normal range. And for many people, especially those over 50, this effect can be dramatic. David stopped the ibuprofen. We found alternative pain management strategies. Within 4 weeks, his pressure returned to 124/78. But NSAIDs aren't the only hidden culprit. Decongestants like pseudoephedrine can raise pressure significantly. Birth control pills can elevate pressure in some women. Certain antidepressants affect blood pressure. Some migraine medications. Even seemingly innocent supplements like licorice root, which is in many herbal teas, can cause significant elevations. The problem is that most people don't connect these substances to blood pressure changes because they seem unrelated to cardiovascular health. Now let me show you hidden cause number 5. And this is where we start getting into the genetic and biological factors that healthy lifestyle simply cannot overcome. Hidden cause number 5 is sodium sensitivity caused by genetic variants. Let me tell you about Patricia because her story illustrates why some people can eat high-sodium diets with no blood pressure changes, while others eating low-sodium diets still struggle with elevation. Patricia was 48, marathon runner, ate an almost entirely whole food plant-based diet, tracked her sodium intake meticulously, kept it under 1,500 milligrams per day, well below recommended limits. Her pressure should have been perfect. It wasn't. It hovered around 148/92. Her doctor kept telling her to reduce sodium further. She was already eating one of the lowest sodium diets I'd ever seen. How much lower could she possibly go? Here's what nobody had explained to Patricia. Approximately 50% of people with high blood pressure have something called salt sensitivity. This isn't about eating too much sodium. This is about how your body processes the sodium you do eat. In salt-sensitive individuals, even small amounts of sodium cause the kidneys to retain more water than normal. This increases blood volume, which raises pressure. But here's the critical part. Salt sensitivity has a strong genetic component. Certain gene variants affect how your kidneys handle sodium, how your blood vessels respond to it, how your hormones regulate it. Patricia had inherited multiple genetic variants that made her extremely salt sensitive. For her, 1,500 milligrams of sodium per day had the same pressure-raising effect that 4,000 milligrams might have in someone without these variants. Her kidneys simply couldn't efficiently excrete the sodium she consumed. We reduced her intake even further, down to around 1,000 milligrams daily, which required extraordinary dietary discipline. Her pressure finally normalized. But the point is this: she was doing everything right by standard guidelines. The problem wasn't her behavior. The problem was her genetics. And here's what makes this so frustrating for patients. You can't see genetics. You can't feel them. You just know that you're following all the rules, and your body isn't responding the way it's supposed to. This is why blanket recommendations don't work for everyone. Some people need individualized approaches based on their unique biological makeup. Let me show you hidden cause number 4. And this is where we get into hormonal disorders that can masquerade as simple hypertension for years before anyone figures out what's really happening. Hidden cause number 4 is primary aldosteronism. And I need to tell you about Robert because his story reveals how common this condition actually is among people diagnosed with high blood pressure. Robert was 56, active lifestyle, healthy weight, no family history of hypertension, suddenly developed elevated readings around 155/98. His doctor prescribed standard blood pressure medication. It barely made a dent. They added a second medication, still not controlled, a third medication, minimal improvement. Robert was on 3 different drugs, and his pressure was still 145/92. This should have raised red flags immediately. When someone needs multiple medications and still can't achieve control, there's often an underlying cause beyond essential hypertension. I ordered specific hormone testing, and there it was. Robert's aldosterone level was significantly elevated. His adrenal glands were producing too much of this hormone, which causes the kidneys to retain sodium and excrete potassium. This drives blood pressure up significantly. Here's what's shocking. Studies suggest that up to 10% of people with high blood pressure actually have primary aldosteronism. 10%. That's millions of people being treated for essential hypertension when they actually have a hormonal disorder that requires specific treatment. We sent Robert to an endocrinologist. He had a small, benign tumor on one adrenal gland, something called an aldosterone-producing adenoma. He had surgery to remove it. His blood pressure normalized immediately, without any medication whatsoever. Years of medications, side effects, frustration, all because nobody had tested for this specific condition early on. But here's the broader lesson. There are multiple hormonal disorders that can cause elevated blood pressure. Hyperthyroidism, where the thyroid produces too much hormone. Hypothyroidism, where it produces too little. Cushing's syndrome, where the body produces too much cortisol. Pheochromocytoma, a rare tumor that secretes adrenaline. All of these can elevate blood pressure in otherwise healthy people, and all of them require specific testing to identify. Now let me show you hidden cause number 3, and this is going to seem almost impossible until you understand the mechanism behind it. Hidden cause number 3 is chronic pain and the inflammatory processes that accompany it. Let me tell you about Linda because her story connects pain and cardiovascular health in ways that surprised even me. Linda was 67, generally healthy, active gardener, ate well, normal weight. Her blood pressure had always been fine until about 2 years before I met her. Then it started climbing, 140/86, then 148/90, then 155/94. Nothing in her lifestyle had changed. We couldn't identify any obvious cause. Then I asked about other symptoms. She mentioned that she'd developed chronic lower back pain about 2.5 years earlier, degenerative disc disease. She'd been managing it with physical therapy and occasional pain medication, but the pain was constant, every single day. Here's what recent research has discovered, and this is fascinating. Chronic pain doesn't just hurt. It creates a state of chronic inflammation throughout the body. This inflammation affects blood vessel function. It disrupts the endothelium, the inner lining of blood vessels. It increases oxidative stress. It activates the sympathetic nervous system. All of these processes raise blood pressure. But there's more. Chronic pain also frequently leads to depression and anxiety, both of which independently increase hypertension risk through hormonal and neurological pathways. Linda's pain was literally driving her blood pressure up through multiple interconnected mechanisms. We intensified her pain management, not just with medication, but with a comprehensive approach including physical therapy, mindfulness techniques, and eventually a procedure to address the disc problem. As her pain decreased, her blood pressure followed. It didn't normalize completely, she still needed one medication, but it dropped from 155/94 to 132/80. This reveals something critical about blood pressure management. Sometimes the path to cardiovascular health goes through treating conditions that seem completely unrelated. If you're in chronic pain, it's not just about quality of life. It's about cardiovascular risk. Let me show you hidden cause number 2. And we're getting very close to the most important hidden factor of all. Hidden cause number 2 is kidney artery stenosis. This is a narrowing of the arteries that supply blood to the kidneys, and it can occur in relatively young, healthy people through a condition called fibromuscular dysplasia. Let me tell you about Michelle, 42, ultra-healthy lifestyle, CrossFit athlete, competed in fitness competitions. Blood pressure suddenly spiked to 165/100. This was shocking for someone her age with her fitness level. Standard medications weren't controlling it well. I ordered a specialized imaging study of her kidney arteries. The right renal artery showed significant narrowing, not from atherosclerosis, which would be unusual at her age anyway, but from fibromuscular dysplasia. This is an abnormal cell growth in the artery wall that causes narrowing and reduced blood flow to the kidney. Here's what happens physiologically. When the kidney doesn't receive adequate blood flow, it interprets this as low blood pressure in the body. It responds by activating the renin-angiotensin-aldosterone system, a hormonal cascade designed to raise blood pressure. The problem is the kidney's perception is wrong. The body's blood pressure is fine. It's just the kidney that's not getting enough blood because of the arterial narrowing. But the kidney doesn't know that. So it triggers a massive pressure increase throughout the entire body, trying to force more blood through the narrowed artery. Michelle had a procedure to open the narrowed artery. Her blood pressure normalized within weeks. But here's the scary part. This condition is often missed for years because nobody thinks to look for it in young, healthy people. It takes specific imaging to diagnose. If you have high blood pressure that developed suddenly, especially if you're young and healthy, this is something that should be investigated. And now we've arrived. Hidden cause number 1. The most common, most underappreciated, most important factor that explains why millions of seemingly healthy people have elevated blood pressure despite doing everything right. Are you ready? Here it is. Hidden cause number 1 is genetics. Specifically, inherited essential hypertension that has absolutely nothing to do with lifestyle factors. I know what you're thinking. That's it? Genetics? Yes. And let me tell you why this is so much more important and complex than you might realize. Let me tell you about James. 38 years old, former college athlete, still worked out daily, didn't smoke, barely drank, ate an exemplary diet, body fat percentage around 12%. He looked like the picture of health. His blood pressure was 158/96. He came to me frustrated and angry. He'd been told by multiple doctors to exercise more, eat better, lose weight. He was already doing all of those things to an extreme degree. What more could he possibly do? I asked about family history. His father had high blood pressure diagnosed at age 35. His mother had it at 40. 2 of his 3 siblings already had it in their early 30s. There was the answer. James had inherited a genetic predisposition to high blood pressure that was so strong no amount of lifestyle modification could overcome it. And here's what most people don't understand about genetic hypertension. It's not one gene. It's dozens, sometimes hundreds of genetic variants, each contributing a small effect that adds up to significant elevation. These variants affect how your kidneys handle sodium, how your blood vessels respond to hormones, how your nervous system regulates vascular tone, how your body produces and responds to nitric oxide, which keeps vessels dilated. For someone like James, with a strong genetic burden, elevated blood pressure is essentially inevitable. His body is biologically programmed to maintain higher pressure. This isn't a lifestyle disease for him. This is a genetic disease that manifests in his cardiovascular system. Does this mean lifestyle doesn't matter? No. Lifestyle still matters enormously. If James ate poorly and didn't exercise, his pressure would probably be 180/105 instead of 158/96. Lifestyle is keeping it from being even worse. But lifestyle alone will never normalize it. We started James on medication. His pressure came down to 125/78. He was initially resistant to taking medication, feeling like it was admitting defeat. But here's what I told him, and I need you to hear this if you're in a similar situation. Taking medication for a genetic condition isn't failure. It's smart medicine. If someone has diabetes because their pancreas doesn't produce enough insulin, we give them insulin. We don't tell them they're weak or they failed. We treat the underlying biology. Blood pressure is no different. If your body is genetically programmed to maintain elevated pressure, medication corrects that programming. But here's what James's story, and all the stories I've shared today, teach us about the fundamental nature of high blood pressure in healthy people. Blood pressure is the result of dozens of biological systems interacting simultaneously. The kidneys regulating fluid balance, the blood vessels constricting or dilating in response to hormones and nervous signals, the endocrine system secreting aldosterone, cortisol, thyroid hormone, adrenaline, the sympathetic nervous system responding to stress, pain, sleep disruption, the genetic code determining how efficiently all these systems function. Any disruption in any of these systems can elevate pressure, regardless of diet or exercise. This is why the advice to just eat better and exercise more, while well-intentioned, is often inadequate and sometimes insulting to people who are already doing those things. It assumes that high blood pressure is always a lifestyle disease. It's not. Sometimes it's a genetic disease, sometimes it's a hormonal disease, sometimes it's a kidney disease, sometimes it's a sleep disorder, sometimes it's a pain disorder, sometimes it's medication-induced, and sometimes it's a combination of multiple factors that creates a perfect storm of elevated pressure that no amount of kale smoothies will fix. So what do you do if you're someone who's healthy but still has high blood pressure? First, you work with your doctor to investigate whether any of these 7 hidden causes might be contributing. Sleep study to rule out apnea, medication review to identify potential culprits, hormone testing to check aldosterone, thyroid function, cortisol levels, kidney artery imaging if your pressure came on suddenly, genetic counseling if there's strong family history, assessment of chronic pain and inflammatory conditions. Second, you recognize that needing medication doesn't mean you failed. It means you have a biological condition that requires medical treatment. Just like any other medical condition, there is zero shame in taking a medication that protects your heart, your brain, your kidneys from damage caused by elevated pressure. The shame should be reserved for the medical system that sometimes makes people feel guilty for needing treatment for a condition they didn't cause and can't fully control. Third, you continue the healthy lifestyle practices even though they're not sufficient on their own. Exercise still matters, diet still matters, stress management still matters, not because they'll necessarily normalize your pressure, but because they provide cardiovascular protection through mechanisms beyond blood pressure. They improve cholesterol, reduce inflammation, enhance insulin sensitivity, strengthen the heart muscle, improve endothelial function. All of that matters. Fourth, you become an advocate for yourself. If your pressure isn't controlled on standard treatment, push for investigation of secondary causes. Don't accept suboptimal control. Don't accept side effects that make you miserable. There are many different medication classes, many different approaches. Work with your doctor or find a new doctor until you find the approach that works for you. Let me tell you about Sarah one more time because her story brings everything together. Sarah was 52, healthy in every visible way, but struggling with blood pressure around 150/92. We investigated thoroughly. She had mild sleep apnea, which we treated. She had been taking ibuprofen regularly for headaches, which we stopped. She had a genetic predisposition based on family history. She had slightly elevated aldosterone levels, not enough for a diagnosis of primary aldosteronism, but enough to contribute. Each of these factors alone might not have been enough to cause significant elevation, but together they added up. We treated the sleep apnea with a dental device. We managed her headaches with different approaches that didn't involve NSAIDs. We started her on a medication that specifically blocks aldosterone. We acknowledged that genetics played a role she couldn't change. Her pressure is now 126/78. She's healthy, she feels great, and most importantly, she understands that her blood pressure isn't a moral failing or a lifestyle problem. It's a biological condition that required biological solutions. Now you understand the 7 hidden causes of high blood pressure in healthy people. Obstructive sleep apnea disrupting your cardiovascular system every night, medications and supplements you take without realizing their effects, genetic salt sensitivity making your body overreact to normal sodium intake, hormonal disorders like aldosteronism driving pressure up through aldosterone excess, chronic pain and inflammation creating a cardiovascular burden, kidney artery stenosis triggering a hormonal cascade, and the big one, genetics, the inherited predisposition that no lifestyle change can fully overcome. If you're someone who's doing everything right and still has elevated blood pressure, I want you to know something. It's not your fault. Your body has biological reasons for maintaining that pressure. Your job is to work with your doctor to identify those reasons and address them appropriately. Sometimes that means treating an underlying condition. Sometimes that means adjusting medications. Sometimes that means accepting that you need blood pressure medication long term. All of those are valid, acceptable, and nothing to feel guilty about. Share this video with anyone you know who's frustrated by high blood pressure despite a healthy lifestyle. Subscribe to this channel for more information that goes beyond surface-level advice and gives you the deeper understanding you deserve. Your cardiovascular health is too important to be reduced to oversimplified slogans about diet and exercise. You deserve to know the truth about what's really happening in your body. Take care of yourself, advocate for thorough evaluation, and I'll see you in the next video.